Today we're going to talk about human sexuality. We're going to be talking about men. And I think we talked about an intervention called orgasmic meditation on the last one that I posted a couple of weeks ago. And today we're going to talk about male sexuality. So hit the thumbs up, like this page, and subscribe. I'm going to be posting this onto YouTube also. And today's it's a pretty big issue, but we're going to spend about 15 or 20 minutes on it. So if you have any questions, please post them. If you post them on either YouTube or Facebook, I will try to address them and post an answer within a timely manner within the next couple days. Okay, so let's see here. I keep having things popping up. Want to make sure the flow is going okay. So I had a little noise in the background today, so I'm using the headset, and hopefully you won't hear too much reverberation from the headset. But men's sexuality and women's sexuality are complex topics, and it's not as simple as people think. Often I see men or talk to men that are having issues with erectile dysfunction, or for short, they call it ED now, or some other type of sexual dysfunction. And often people are depressed and they lack motivation when they start having problems in this area. And there are many different reasons for why it can be happening. So I'm going to get right to it to start talking about the reasons. So, and this list is not going to be exclusive, but these are some of the common reasons that I see in my practice. So many times when male patients are seeing male doctors as their primaries, sometimes the primary doesn't even ask, and I don't think it's for lack of interest. I think it's just that the primary care doctors don't have enough time to ask the right questions. So a lot of times they haven't asked the right questions. So often what I'll ask, one of the first things I ask is the man having erections in the morning? And because when a man first wakes up, like, there are things that happen through the night with the hormonal systems and with just the autonomic nervous system in general. And they typically should wake up with some type of erection. Often when I talk to men, they have not had one for a while, or they are having much less of them. And the problem that we get into with the primary care doctor sometimes is that if we don't ask this question, we don't know whether the circulation and the nervous system are working properly. Because if it's not happening every morning, then the nervous system might not be working properly. And it could also be the hormonal system is not working properly. So we have to ask certain questions. A lot of times people are under a lot of stress. Like right now, a lot of people are having problems because they're under a lot of stress. Their days are not going the way that they normally go. They're not going out to work, which is an important function for men. Men are protectors, providers. So sometimes they don't feel as useful if they're not getting out to do their work, or they're having problems successfully performing work at home. And this can affect the stress levels and affect sleep. Sleep is one of the main issues that I see that's affecting sexual health in both men and women. People, before the pandemic started, a lot of people were not getting enough sleep. The average American does not get enough sleep. The average American gets like 5 or 6 hours of sleep, and most human beings require 6.5 to 8.5, 9 hours of sleep. So we have those two factors, and sleep can really affect the hormonal levels and affect the autonomic nervous system functioning. So autonomic nervous system means part of the nervous system that's automatic, and you don't think about it, it just runs certain systems in your body. Think about your digestion, and when you're sleeping, your digestion is running and you're not thinking about it. Think about like if you have to run away from a bear. You don't think too long. It's more of a lot of reflexive action that goes on when you're trying to escape death. So, and that's a demonstration of the sympathetic nervous system, and the rest and digest is a demonstration of the parasympathetic nervous system. Both systems have to be working properly in order for sexual functioning to work properly. So I would say the number one reason that I see people having problems, men having problems, is because of side effects of medication, or drug use, or alcohol use, or tobacco use. So these are considered toxins by your body. Yes, medications are considered toxins by the body, and your body has to work hard to get rid of all of these types of toxins. The liver and the kidneys have to work well when you're taking medications. And what we have right now in our society is we have a lot of toxicity in our food, in our air, in our water. We have toxicity in our relationships, and all of this impacts our ability to be able to get rid of toxins out of the body. So medications, alcohol, street drugs, and tobacco products. These are the top reasons, some of the top reasons that I see people having problems. Next in line would probably be stress, fatigue, lack of sleep. I would probably group those things together. And we talked a little bit about sleep. Stress, we mentioned that. I'm talking about emotional stress, but stress is also physiologic. So it can be things that your body sees as stress. So when your body sees medications and it's having trouble metabolizing them, or the body sees tobacco, nicotine, which is a drug, and the body has to get rid of it, plus alcohol, plus medication, or either or, then that's a stressor on the body, because the body has to utilize nutrients and energy in order to get rid of those things out of the body. Fatigue, it's probably due to lack of play, or lack of motivation, or lack of sleep, or overwork, overstressed, and not enough sleep. So, or not properly processing emotions. So these types of things can affect our nervous system functioning, and that can directly affect sexual health and the responsiveness of the organs and also the hormones. So let's see. let's talk about the hormones. So this is one of the things that primary care, I think, kind of, they're forced to over address the hormonal insufficiencies or hormonal issues, sometimes without proper testing. So oftentimes I'll see people that are on testosterone replacement of some type, and they are not being followed. They're not getting blood work, and they may be having side effects and not knowing it. People can be easily overdosed on testosterone, and the body will shift production of hormones and start producing estrogen. So let's see. Sorry about the interruption. My computer's trying to update while I'm talking. But so when someone is on testosterone, and by the way, I forgot to mention a disclaimer that this video is for entertainment and educational purposes only. It should not be construed as medical advice. And those of you who watch this channel should know that. And if you need help, you need to contact me. You can contact me at 703-454-9326. I prefer that you contact me either through my webpage at treatyourselftohealth.com, or you can email me at info@treatyourselftohealth.com. I don't like private messaging on Facebook for this purpose, but if you just don't include your personal health information if you're going to send me a message on Facebook. All right, so if you're liking this video, please hit the thumbs up, please hit the like, please subscribe, and please go to YouTube and subscribe. All right, so there is an enzyme that's called aromatase, and when there is too much inflammation in the body, which most of us have, but we don't recognize that we have it, and a lot of people have problems with sugar regulation nowadays because we're eating too much processed food or eating foods that are high in pesticides or PCBs, plastics, other issues with toxins in the environment. So that can affect our hormone production. And then when you're taking testosterone, it can start converting the testosterone to estrogen. The only way to figure that out is to actually test the whole hormone cascade. It's actually, you need to look for problems with sugar regulation, which is more than just looking at the glucose. You need to look at the A1C, fasting insulin. There are a couple of other measures that we look at, but most primary care doctors are not going to order that. You have to ask specifically for it. And most men may be becoming desperate, and they trust their doctor and they know that other guys are getting help by taking testosterone, so they think that it's for them too. The problem with testosterone is, or the problem with all hormones is, when you start taking an exogenous or a hormone from the outside, inside of your body, it will shift the hormone cascade of other hormones. And we have 600 hormones and neurotransmitters in our body. So it is going to impact most of those, and you're going to get side effects that you may or may not recognize. So it is best to make sure that the testosterone is actually in some type of deficiency. And that does not mean that the testosterone has to be below 200, but we need to demonstrate that there is an issue with the testosterone. And we also need to closely follow the side effects and closely follow other hormones that may be impacted by the testosterone. So some of what I've said, like the nervous system, the hormonal systems, the behavior, emotional systems impact libido or sex drive. So low libido is something that I'm seeing a lot of issues right now with people with mental health issues, and the mental health issues will impact libido. That means that men just won't have any sex drive. So sex drive is a complex thing. It involves several hormones, the nervous system, environment, relationship with the partner, toxicity, toxicity of emotions. So there's a lot of things that are impacted. So that's a few of my thoughts regarding this area. So I'm going to sign off now. Thanks for joining, and hit the thumbs up, hit the like button, subscribe, and I look forward to seeing you next week. And hang in there. And much love to the folks down south. I actually have relatives in Alabama, so I'm kind of concerned, and relatives in Georgia about this hurricane. I'm hearing that it's hit the Gulf Coast and it's moving up now. So let's keep everybody in our prayers and thoughts, and hopefully we make it out of this one safely. All right, take care. Bye-bye.